Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast on the Common Sense MD. Today I want to talk about something that I've been wanting to talk about for a long time. As a matter of fact, I was reminded of something that my mom told me. We all have a book in us. And really, if I was to write a book about my experience, of course, it would be in the healthcare system. And I think I would term it, Worry About This, Not That, concerning your health. But I was reading one of Dr. Peter Attia's latest blogs. I really follow him a lot. I like him a lot. He's a heavy hitter, longevity expert, and does a lot. I call him the researcher of research. So he's always has something up to date on things. So I really related to this, and it really reminded me of something that I've been meaning to talk about for a long time. So I'm going to call this a little fireside chat about health anxiety. You know, when a condition becomes concerning, the relationship between health anxiety and mortality, it's something that I see a lot, and really, at times I have to be very honest with my patients and about when I think they're kind of overdoing it a little bit. You know, as a family doctor, which is a very important part of the healthcare system, really it starts with your family doctor. And I like to be an old-timey type, old-fashioned doctor that gets to know my patients. And because I think that's important, because really you get clues as to when something's important and when something isn't important. You get to know them and their family, and because a lot of times anxiety walks into your office manifest in some other condition or worry. And that's a key word, worry. Some people come to me and they've been through every medical test in the book, seen multiple doctors, and they haven't been able to really find the cause. As a matter of fact, a lot of people come to me because of that, because I do look maybe a little bit deeper into certain things and take into consideration other types of testing and other types of alternative treatments. You know, I really call myself a blend between traditional and alternative, knowing the best of both worlds. Because if you get too far on one end or the other, you know, you're not doing yourself justice. So in some of my patients, and I tell them this, that they may be overcooking their grits a little bit, if you know what I mean to say about this. That's a term really that some people call hypochondria. But the best medical term for this is really health anxiety. You know, like anything, there's a spectrum, and we're all on that spectrum to some degree. We all have anxiety about our health to some degree, rightly so. But the extremes can be damaging to your health. From one extreme, people can totally ignore the healthcare system. You know, they can smoke, they can drink too much, they can eat whatever they want, they can avoid screenings and really just ignore the healthcare system altogether. On the other extreme, people that are overcooking their grits can pay too close attention, and it crosses over to what we call health anxiety. I see a lot of this. You know, you need to be concerned with what to worry about and what not to worry about. That's where a good practitioner comes in handy, somebody that really knows you. And I see people that have both extremes at the same time. Like a woman would come in to see me and her estradiol level was 60, and through reading and her own research, she thinks, well, it needs to be close to 80 instead of 60. It's very close, believe me. And yet I notice she's smoking 2 packs of cigarettes a day and is obese. So, you know, that person has their priorities wrong. You know, they need to worry about what's important and not a few numbers that are very close together anyway. So that's really the part that the people that don't make much sense to me at all. And I'll tell them that, but I'll tell them that very nicely, you know, because we have to be empathetic. We don't know what they've gone through. So when health awareness crosses into health anxiety, it can lead to a lot of excess worry and what I call hypervigilance. And a recent study reviewed by Dr. Attia kind of points it out. It shows that really this kind of behavior really undermines their health and their quality of life by causing stress. So really, it can turn into a chronic psychiatric condition marked by an intense fear of having a serious illness. These anxiety-driven people frequently pursue tons of medical testing, imaging, and procedures, and really overuse the medical system and overuse medical resources. Sometimes, and it's usually, I try to reassure these people. One thing my dad, who was a general surgeon, told me that the most important words I would ever speak to a patient are words of reassurance. And a lot of times that's very helpful when you're in an emergency situation about ready to do surgery or, sew somebody up or something like that. But when it becomes chronic, sometimes that reassurance is temporary. They go back to their old ways of worrying about this. Sometimes I've found that when a patient wants more tests than they really need, and I tell them, well, your insurance is not going to cover that test. It's going to cost you $1,000 out of your pocket. Why don't you consider waiting a little bit and seeing what happens? So a lot of times that works. When it hits them in the pocketbook, it really works some of the time, because otherwise they'd go bankrupt if they didn't overuse the medical system. So really the medical system's here to help you when you need it, believe me. But usually they don't quit worrying. I always try to get to the root cause of the problem. And that's what's important in integrated medicine that we practice, performance medicine. So they did this study in Sweden where they studied many, many people for several decades. And the people they studied were the people that had the diagnosis of hypochondria, which, believe me, is very underdiagnosed, to see if they had higher death rates than people that didn't have this diagnosis, in which they did have higher death rates, unsurprisingly. In fact, 69% higher, both of natural and unnatural causes. Of the natural deaths, they had a 52% increase in risk of circulatory diseases and a 133% increase in respiratory diseases. Suicide was the largest contributor of the unnatural deaths, unsurprisingly. And again, you have to know that hypochondria is vastly underdiagnosed. Increased stress causes increased cortisol. I've talked about it many times. Increased cortisol, chronically increased cortisol, suppresses the immune system. And it also causes insulin resistance, which is the root cause of metabolic disease, which most Americans suffer and die from. Think about heart disease and hypertension. So, I think some of these tendencies really are genetically passed down as well as culturally. There's no doubt about it. It's normal to have some anxiety about your health. But when your doctor is telling you this, most likely it's true. And you need to focus on treating the anxiety, not chasing so many things down that are not going to help you out. It's just going to cause more worry. Now, again, I'm a tester, I'm a screener, but it can become, in a certain select patients, it can become a problem. I have several of these problems. You probably know who you are if you listen to my podcast, you see me, and you are like that. So pay attention to your health and screenings, and ask your doctor or your provider to be very honest with you. If so, get help from a mental health expert if you need to. Look at the root cause of your anxiety and worry. Sometimes it takes some work to get to the root cause of problems, and that's one thing we like to do. A lot of times I'm very excited when I finally get to the root cause of a problem or many problems that may kick off autoimmune diseases, for example. So as healthcare providers, we can pick up on things like this. If we get to know you and we review all the things you've been through and the tests that we do on you. And in most cases, when I say get help for your anxiety and worry, I'm not talking about drugs. Sometimes we have to use them, of course. The truth is that there are simple, effective ways to get anxiety under control, like exercise, the greatest anxiety cure of them all, believe me. I've suffered anxiety like most people have. I even had a couple of panic attacks years ago. So it's not a weakness. It doesn't mean you're crazy. It just means you need to start thinking about this. Eating whole foods, getting a good night's sleep, having good relationships, checking your hormones as you go through menopause or andropause, looking at those autoimmune conditions as well. Cognitive behavioral therapy helps for health anxiety. Remember, think about your health span, not your lifespan. All of us will die. Be smart and enjoy your life while you're here. So pay attention to these clues. Talk to your provider. If you think you maybe are overdoing this, be honest about it and try to get to the root cause of the problem. That's as important as a thing as a doctor that I can do for you, really. So start thinking about these things. If you suffer from this, or you have friends or family, loved ones that may benefit, please share this video with them and talk to them about it. And if they finally will realize, hey, maybe that's me, they can begin that journey towards better health. I mean, it all starts with them realizing they may have a problem with this, a problem with overdoing it. So try to stay healthy, do your research, think about yourself. When others tell you something about yourself, especially your doctor that knows you for years, heed their advice, please. So I hope that helps you and maybe some other people. I'll see you again next week.